Simon Gagné, age 25, has been diagnosed with asthma. His doctor has prescribed 2-meter dosed inhalers, Salbutamol and Fluticasone, to him. He has an appointment with the Asthma Training Center to learn how to take both medications.
Simon Gagné, room 2, please. Hi, Simon.
Hi.
My name is Philip, and I'm the nurse in charge of the asthma clinic. So I'm just going to have you take a seat here. So before we start, can I confirm your full name as well as your date of birth, please?
Yeah, so my name is Simon Gagné, and my date of birth is the 19th of February, 1994.
Perfect.
To prevent mistakes of any sort, the nurse asks the client to identify himself by providing his full name and date of birth.
So how are you doing today?
I'm doing okay. My doctor told me that I have asthma and that I need to be taking medication now, and it's kind of got me a bit worried.
Okay, well that's what we're here to talk about. Looking in your file, and I see that the doctor has described 2 medications. So the first is your blue inhaler here, which is your Salbutamol. And the second one here is Fluticasone, the orange inhaler. So what we're going to do is I'm going to go over each medication for you and show you how to use them.
Okay.
Okay?
Yeah, I've never used one before, so I'm kind of worried about that.
Okay, well hopefully after we're done here you'll feel better about that. So to start off with, your Salbutamol, this is basically like an emergency medicine. It's a fast-acting bronchodilator, so you want to use this when you're having an asthma attack. What it does is it goes and it lodges on the walls of your bronchi in order for your bronchi to dilate and for the air to go through better. Since it's a fast-acting medication, it works for about 4 to 6 hours at a time. So you're going to be able to take this maybe 4 times a day.
Okay, so basically if I've got this right, I'm taking the blue medication when I'm having an asthma attack.
That's exactly right, as a go-to rescue medication.
Perfect.
Your Fluticasone, this is an anti-inflammatory medication. It works more in a long-term sense. What it is it goes once again on the walls of your bronchi, but to reduce the inflammation. Now it takes about 24 to 48 hours before you start feeling the actual effects of this medication. So it's important that you take it at least twice a day and for a longer period of time.
Okay, perfect. So just to sum it up, I'm taking the blue medication if I'm having an asthma attack, and the orange one is sort of on a regular basis to prevent them from occurring.
That's exactly right.
Okay.
Okay. So basically, I'm just going to show you how we use an inhaler. What you're going to do is you're going to exhale through your mouth to get as much air out of your lungs as possible. The first thing that's really important too is to shake it.
Okay.
Shake it up, and because inside each capsule, there's 2 components. You have a pressurized gas, that's a propelling gas, as well as the medication. The propelling gas makes it so that the medication goes directly, properly into the airways. So you're going to shake it, and then we're going to take the cap off. You exhale through your mouth. You put it about 2 to 5 centimeters towards your mouth, and then I'm going to inhale as I'm pushing down on the button. I'm going to hold my breath for maybe 5 to 10 seconds, and then let the air out through my nose.
Okay, perfect.
Shaking the meter-dosed inhaler before usage allows the medication and propelling gas to redistribute evenly inside the cartridge. The meter-dosed inhaler can be used with the mouth open or placed directly into the mouth. The open mouth technique allows the medication to be inhaled into the lungs more efficiently and reduces deposits on the oropharynx. Holding your breath enables the spray droplets to better reach the bronchial walls.
Okay, so you're ready to give it a try?
Yeah, sure. I had a quick question before that.
Okay.
If I need to take 2 doses, can I just go ahead and take them back to back?
That's a great question. Actually, you just need to make sure, the important thing is you wait a minute between each dose and that you shake the inhaler between each dose as well.
Okay, perfect.
Okay.
Yeah, so I'd like to give it a go. First, I'm just like to sort of say the steps to make sure I've got everything down.
Sounds
so
good.
first I got to shake medication. I'm going to take the cap off after that. Exhale as much air as possible out of the mouth. Bring the mouthpiece about 2 to 5 centimeters from the mouth, and then inhale as I'm pressing down on the button. Hold my breath for about 5 to 10 seconds, and then exhale through the nose.
That's exactly right.
Perfect.
Let's give it a try.
All right. Did I miss anything?
No, everything looks good. Okay, so I'm just going to go over some of the side effects of some of these medications. Now, your salbutamol, it can cause nervousness, a bit of agitation and trembling. However, they're short-term side effects, so they won't last very long. And then for your fluticasone, it can cause dry mouth as well as a fungal infection. So once you've taken your inhalations, it's important that you rinse your mouth out with water to prevent the fungal infection.
Okay, perfect.
Okay. So did you have any other questions?
No, not for today.
Okay. Well, you have my number. If you have any questions, feel free to call me and I'll try and answer your questions as best I can. And if not, well, have a good day.
Yes, well, thank you. To you as well.
Perfect.
Bye.